Um, Before the surgery, I had some accidents that did some damage to my left hip, and the left leg was shorter than my right leg, so I had an increasingly bad limp. And then in December of 2016, it felt like my whole hip joint had come apart. I had very intense pain. I could barely walk. I was staying in a hotel in Singapore at the time because I was working, and my hip never really recovered from that. I had difficulty walking, I had pain at night, difficulty sleeping, so I made the decision I needed to have it fixed. Okay, once I had made the decision I needed to do something, I contacted my son in Perth in Western Australia, who is a medical doctor. His specialty is sports medicine, which means he's heavily involved in orthopedics, particularly knees and shoulders, not so much hips. However, he said he would find out the best place for me to have the operation. The key for me is that I travel through Bangkok very regularly for work. So he spoke to the Smith & Nephew rep in Perth, and Smith & Nephew, they make the prostheses for the hip. And the Smith & Nephew rep in Perth contacted the Smith & Nephew people in Bangkok, and they recommended Dr. Nanaport and Payatai Hospital. So I went online and checked out both the doctor and the hospital and found that I could make an appointment online, which I duly did. And in, I think it was January, middle of January of 2017, I had my first appointment here, and 1 month later I had my hip replacement operation. Well, I guess my first experience was being able to make the appointment online, which, given that I'm not resident in Bangkok or indeed Thailand, made things very easy for me. And the hospital gave me a fixed price package for, I think, 5 nights in hospital, the operation, any medicines and procedures that took place while I was here was all covered in the set fee. So that made it very easy for me to budget. I was able to arrange the money so that when I was here, I paid cash by my credit card, settled their whole account in about 5 minutes. The surgery, I think, went well. Initially, I had pain, and I was on painkillers. But once the pain went and the mobility of my leg increased, it was like going back in time. I am now able to do things that I haven't been able to do for several years. I have much greater movement in my left hip than I had before, and it's now probably better than my right hip in terms of ease of movement and just my quality of life is so much better now that both legs are the same length. I don't walk with a limp anymore. I'm able to do things around the house and my garden, and just my whole life has changed because my hip now works as it's supposed to.